Hi friends, in today's class we will discuss about the causes of corneal pigmentation. So it can be divided into in one classification. We will divide it into physiological and pathological. In physiological, we have iron deposition in the cornea, which is called as Hudson stahli line. So this is a age-related deposition in which there is deposition of iron at the junction of upper two-thirds and the lower one-third of the cornea. It is thought to be due to accumulation of tear pool when the eyes are closed. Okay, so this is regarding Hudson stahli line. So this is an iron deposition line. Coming to the pathological causes, so we can divide it into ocular causes such as corneal dystrophy, corneal degenerations. So we will discuss in detail about this in our next class. And there are some systemic causes also, such as deposition. Systemic causes we have Ochronosis. So do comment in the box what is deposited in Ochronosis. And Paget's disease, in which there is calcium deposition, and in Wilson's disease there is copper deposition. So these are some of the systemic causes of corneal pigmentation. And there are some drug related causes. It is called as cornea verticillata. So it is a whirl shaped deposition which is seen in the cornea. So that's why it is called verticillata. Verticillata for whirl, we can remember it like this. So the causes include amiodarone, chloroquine, which is an antimalarial, chlorpromazine, a tranquilizer, and indomethacin, which is a painkiller or NSAID, So these are the causes of cornea verticillata. Then we have argyrosis, that is silver deposition. Then we have adenochrome. So it is seen in with the use of epinephrine and its related compounds chronically. And chrysiasis, that is gold deposition, to seen with gold therapy, which is used for some diseases. And chalcosis is also copper deposition. So we have seen in Wilson's also there is copper deposition, and in Paget's there is calcium deposition. Okay. So these are some drug related causes of corneal pigmentation. Then we have other causes of iron deposition which are pathological. So in physiological iron deposition we have discussed Hudson stahli line. So there are other iron deposits which are seen in some corneal as well as systemic diseases. So in iron deposition we have Stocker's line, so Ferry's line, and siderosis. So Stocker's line occurs in case of a pterygium. It is also called Stocker-Bussaca line. So this is seen at the cap of pterygium, whereas the Ferry's line is seen at the base of a filtering bleb after trabeculectomy, and siderosis is seen in metallic intraocular foreign body which is retained inside the eye. So this is one type of classification, that is physiological and pathological classification. We can also divide it in case of from where this pigment is arrived. Okay, so one, if it is derived from exogenous cause, or endogenous cause. So exogenous, we know, it is based on foreign bodies. It can be due to stains and tattooing of the corneas. And in the endogenous causes, we have um, the deposits are from the pigments which are released inside. So in case of uveitis and in case of myopias, high myopes, and also some in hyphema, that is accumulation of blood in the anterior chamber, and neoplasms like uveal melanomas, and also there is keratitis such as fungal keratitis. So in there are some pigment producing fungi. So these pigment producing fungi called pigmentation of the cornea. Okay. So this is one classification, that is exogenous and endogenous. So one classification was physiological and pathological, and one is exogenous, endogenous. We can also divide it into another classification, that is based on the site of deposition of this pigment. So if it is in the epithelium or in the stroma or the endothelium. Coming to the epithelium, so epithelial deposits can be seen with intraepithelial melanocytes, and in case of stroma we can see secondary to any corneal sequestra or trauma, and in case of limbal melanomas, and also pigmented fungi or pigmented keratitis with fungi. In endothelium, we can see pigmented capies and iris adherent to the cornea, that is adherent leucoma. And also in case of pigmentary glaucomas or pseudoexfoliation glaucomas, we can see pigment over the endothelium of the cornea. And also in pigmented foreign bodies which are retained inside the eyes, we can see endothelial deposits. Okay, so this is one classification based on the site of deposition of the pigment. Okay. Next, coming to another type of classification. So this classification is based on the color of the pigment which is being deposited. So it can be brown pigment. So most of the times brown pigment is also only seen. So with iron deposits in case of foreign bodies, metallic foreign bodies, neoplasias, and drugs and all, brown deposits are only seen. So that's why it's the most common color of the deposit. Then we have grayish white deposits. This grayish white deposit can be seen in case of superficial punctate keratitis and medication related deposits, and also in case of silver deposit, that is in argyrosis. And also characteristically metabolic disorders lead to grayish white deposits. So in this way we can come to a diagnosis also from where the pigment has been derived. Okay, so then we have a sand color or bluish color deposit which is seen in case of chronic soft contact lens usage. So with long term usage of the soft contact lens, we can see this contact lens related things. Okay, so these are the 4 type of causes and the classifications of the corneal pigmentation. I hope you like this video. Please subscribe to my channel and hit the bell icon for updates. Thank you.